All right, welcome back to ABA exam review and the continuation of our 5th edition BCBA practice questions series, where we're going through another set of questions together and breaking them down. If you're new to the channel, welcome. If you're returning, welcome back. Please like and subscribe for all of our updates. Check out behavioranalyststudy.com for all of our study materials, including our combo pack. When you pass your exam, let us know so we can include you in the Sunday shout out. Work hard, study hard. Let's get going. You're running DTT with the client. During DTT, you present a picture of a cat and 3 comparison options: another picture of the same cat, a picture of a dog, and a picture of a bird. The client consistently selects the picture of the cat when presented with the original picture of a cat without any direct reinforcement for making this match. What is demonstrated in this scenario? So immediately we have a pretty straightforward stimulus equivalence question. And when we think about stimulus equivalence, it seems like a daunting topic, but it's really not. You're really just thinking about matching to sample and making connections and relationships between pictures and words and ideas. In this case, we have a client that you are giving a picture of a cat. The 3 options to compare, to match, are the same cat, a dog, and a bird. Now, when we match identical stimuli, what do we consider that? Well, we consider that reflexivity. That would be A equals A. With symmetry, now we're matching A equals B. So that might be a picture of a cat to the word cat. It's not what we're doing here. The client is picking the picture of the cat when presented with the other picture of a cat, the identical picture. And then transitivity, of course, is the highest level, where you have A equals B, B equals C, therefore A equals C. We're clearly not on that level. What we've established here is this reflexivity. A equals A. I present the picture of a cat. My client then matches it to the identical picture of the same cat, even without reinforcement. So we've demonstrated reflexivity. A behavior analyst is working with the client who frequently interrupts during group activities. The analyst likes that the client participates, but thinks that it happens too much, so they decide to use a differential reinforcement of low rates of behavior procedure, where the client receives reinforcement only if the number of interruptions is below a predetermined threshold within a 30-minute period. What is likely the ultimate goal based on this information? So we've got a long question with quite a bit of information. We're just going to treat it like any other question and attack, not jump to the answer choices, but understand what we're given. So we want to know, what's our goal here? What is our goal? We're a behavior analyst, or we have a behavior analyst. The client interrupts too much, but the analyst likes the participation. It just happens too much. So that's the first key. Participation is good. It happens too much. So we need to reduce that. And they chose a DRL, a low rates of behavior procedure. Now, one of the big differences between a diminishing procedure and a low rates procedure is with a low rates procedure, you're not necessarily getting rid of the behavior. You can just be reducing it to an acceptable rate. And given our information, that seems to be what we're trying to do, what the behavior analyst is trying to do. Client participates, that's great. It happens too much. Let's reduce it. Let's set a threshold and reduce it. So what is our goal based on that information? A, completely eliminate the client's interruptions. That doesn't seem to be the goal because the participation is good. It's just happening too often. So we're not trying to completely eliminate it. And that is reinforced, or bolstered, I should say, by our choice of a DRL procedure. B, reduce the interruptions to an acceptable level. Yes, we want to reduce those interruptions to a level that is acceptable, that might be socially valid. So B looks pretty good. C, increase the rate of participation. Well, we're trying to lower behavior here, right? So this is not an increase question. We're lowering this specific behavior. We're not talking about increasing participation. And then D, reinforce the client in the absence of interruptions. What kind of differential reinforcement procedure would that be? That would be a DRO, a differential reinforcement of other behaviors where you're reinforcing in the absence. Instead, we're going with B as our ultimate goal. Let's reduce the interruptions to an acceptable level without having to completely get rid of them. Whenever Claire goes to grab her shoes, you say, those are your shoes. And she says, those are my shoes. You then provide reinforcement. After a week, you point at the shoes and wait for Claire to say shoes and reinforce. Eventually, you reinforce when Claire sees her shoes and says shoes. What are you doing relative to the final behavior target in the scenario? So we're looking at the final behavior target. And what's our final target here? It's Claire seeing shoes and saying shoes. Well, let's think about what kind of verbal behavior or verbal operant that represents. If you see a nonverbal stimulus, if your behavior is evoked by nonverbal stimulus, and you label that stimulus, what do we call that? We call that a tact. So if we're trying to get Claire to tact her shoes, well, what are we trying to accomplish? Are we trying to accomplish a manned training? Are we trying to get Claire to ask for something? No, even from the beginning, Claire's already grabbed her shoes and you are helping her echo, right? Those are your shoes. She says, those are my shoes. It's not complete echoic, but you're not trying to get her to manned in that situation. You're also not trying to train echoics because we're fading, right? We go from her almost echoing what you're saying to pointing and prompting at the shoes and just letting Claire say shoes herself. Eventually, you say nothing and you just let the shoes evoke the behavior. So we're not echoing. What we're doing is tact training, right? We let the nonverbal stimulus become the SD. It's clearly not intraverbal training. Intraverbal training is an exchange where a verbal stimulus evokes another verbal stimulus. It's not what we're trying to accomplish here. We want those shoes to become the SD and evoke Claire's behavior. We're trying to teach Claire to tact. What are we doing? We're doing C, tact training. You conduct a functional behavior assessment for a client who frequently engages in self-injurious behavior. The assessment results indicate that the SIB is maintained by escape from task demands. After reviewing the literature, you identify 2 interventions, including differential reinforcement of alternative behavior and escape extinction as evidence-based interventions for addressing escape-maintained behaviors. What should you consider next before selecting the intervention? Another long question, but we're not intimidated by long questions. Just attack the question and understand what it's asking. So the question wants to know, what are we going to consider next before selecting our intervention? What do we know so far? We know we've done this assessment. We know the results show SIB is maintained by escape. And so you go through the literature and you have 2 interventions that are evidence-based to address the behaviors. So you've got these 2 interventions that you've chosen based on the assessment, based on science. What's next? Well, now we have to consider the client. So A, the intervention that is most commonly used at your place of employment. Well, that's not really relevant to our client. That's not individualized. We've got to consider our client. We've got to consider our resources. We need to individualize our treatment now to our specific client. B, the intervention that is easiest to implement, measure, and explain. It's not always about just being easy. Maybe you choose the more difficult intervention to implement because it's better. So B is not going to always necessarily benefit the client. C, the client's age. Be very careful with age. Age is deceiving, especially with many of the populations we work with. The age isn't really going to tell you the full story. So D, the client's preferences and the potential of each intervention. If you've got 2 identical interventions that are both going to be successful, then you have to consider the client's preferences. We always consider the client's preferences, but giving them that choice is huge. So you've got 2 interventions. You've done the research, you've done the assessments. Now we get with the client, see what they think, and then we assess each intervention, think about the potential. What's going to be best for the client? What's going to motivate them? What's going to get them engaged? And then what's going to make us the most successful? Rachel, behavior technician, is teaching Ben to respond to the instruction, sit down. She consistently delivers the instruction and only provides reinforcement when Ben sits down in response to the instruction. Over time, Ben begins to sit down only when Rachel says, sit down. What is demonstrated here? All right, pretty straightforward question. We've got a situation where Rachel teaches Ben to respond to sit down. And she's delivers the instruction, sit down is the instruction or the SD, provides reinforcement when Ben sits down in the presence of sit down. Eventually, Ben sits down when Rachel says, sit down. When we have a situation where we've established a stimulus that has control over behavior, sit down has control over Ben sitting down, well, what's that called? Well, it's not generalization because we only have Rachel and Ben in this situation. We haven't demonstrated generalization yet. We're not shaping because Rachel's not dealing with approximations. It's simply a one response, right? Sit down, you need to sit down. What we have is stimulus control. We've got a situation where the stimulus, sit down, has control over Ben's behavior. This is what we mean by stimulus control. And then extinction, we're not running an extinction procedure here, so extinction does not fit. Rachel has established sit down to have control over Ben's behavior. What's demonstrated is C, stimulus control. Thank you so much for watching. Check out behavioranalyststudy.com for all of our study materials. When you pass, let us know so we can include you in the Sunday shout out. Work hard, study hard. We'll see you soon.